a couple of different length needles. These are quite small ones. That's mainly because Carol's a girl. Not just gender-wise. I'm just pulling on it. But I'm allowed to do that.
Hey, now. Was pretty.
Alright, so if we got. So Josh, you want to come up close here? There's a small little needle. It's extremely thin. It's about the thickness of a hair, if you look at it. So if you put it against a white background, you can actually see it better there. This is a very thorn. This is a half-inch needle that you can see, but it's inside. It's within a little applicator tube, and we use a tube as a guide to get it into the tissue. So what we do is we tap it quite quickly in there. Kara's being very brave and not screaming and howling. Of all the places in the body, this is probably the most discomfort. Okay. And what that needle is doing right now is basically augmenting the blood supply. It's a physical intervention or an irritation in the tissue.
Yeah.
And Kara, if you got that correct, that's causing you the same discomfort, isn't it?
Mm-hmm.
Okay. Describe the discomfort. Is it horribly painful? What do you feel?
On a scale of 1 to 10, when you have that in there, it's probably at its worst. It's more of a really deep sore.
And really it's what, for the first 20-30 seconds, because once it's in there now,
No, it's fine.
it quite settles down quite quickly.
Yeah.
It's that first little piece that's miserable that's doing it. Now, as I said, this is probably one of the most painful parts in the whole body as well. If you're doing it into the middle of a muscle, it's a lot less discomfort. This is tendon tissue, like I said before, it's a transmission fiber. It doesn't have a terribly good blood supply. Its capacity for healing is quite limited. But if you use it into a tendon, it's an excellent way of augmenting tissue healing. And clearly this is like a sort of progression from massage or manual therapy. We don't do this as a first choice. It's our sort of last intervention, but again, our main brief has to be effective, to get your patient or get your trainer to get back as quickly as possible to get back to what you can do as well. So I think brick and it's gone. It's just a little piece there, and you can see that's in the top part of it. But even that little piece there as well, when you're
It gives
pushing
it
it down,
instant relief.
it is. You can push it down.
So before he was pressing on it, and it just is a deep pain sore, and
that's already a whole lot more comfortable.
yeah.
All right, guys.